Dr. Rogers is everywhere. He's in the classroom, he's in the office with athletes, he's on the field at their practices, he's at the games.
And I can promise you one thing, I feel a whole lot better putting my head on a pillow at night knowing that I've got him backing me up and taking care of our athletes.
When you sit back and say, hey, what kind of physician do I want to be? Everybody says, hey, I want to be caring, I want to do my job great, and to see someone that does it, it's impressive.
Yeah, how I got interested in osteopathic medicine, I was a Division I athlete, played soccer, really liked getting involved with the hands-on kind of stuff. I was one of those that didn't like to take a whole lot of medicines if I didn't have to. I wanted to feel what my body was feeling, and so that really translated and kind of resonated with me. So when I was looking at medical schools and looking at osteopathic schools specifically, the hands-on approach and using our hands as an extra set of tools that will go with us wherever we go, that really made a whole lot of sense to me. And for me, wanting to go into sports medicine, that gives me another tool that I can use on the sideline, in the training room, wherever I'm going. And I think my job here is multi-dimensional. So we, having a good balance. I'm married and I have 2 young kids. So trying to balance the family life and the academic life and the clinical life. So between outpatient private practice, between working with Virginia Tech and local high schools and minor league baseball with the Pulaski Yankees, there's a lot of stuff in motion. And so I think, biggest part too is, I want to be there to teach, and I also want to be kind of a role model.
In the classroom, he's just so knowledgeable, but in a way that he can make students understand even the most technical aspects of osteopathic medicine and really break down what he does on a day-to-day basis. And the manner in which he relays all this information, it's like, he's cool as a breeze. He's walking around the classroom, really keeping it interactive, and there's no comparison to his teaching style. And it's the same with him, with his athletes. There's no comparison to how comfortable he makes the athletes feel in offices.
I usually don't like saying this, but I feel like I'm uniquely qualified to talk about Dr. Rogers. And the reason I say that is I've been around here for 18 years. Before that, I've been in the profession another 10 years before that. And I deal with a lot of team physicians. I deal with a lot of folks that are going to school to be a team physician, and I'm around a lot of athletic trainers. And he stands out to me because his ability, one, to take care of student athletes, but the other thing is to teach other folks, whether it's athletic trainers, whether it's other physicians. Sometimes he has to do the hard thing of letting people know they're wrong, and he does a great job of doing that without breaking them down too far. And then has a way of coming right back around and building them back up and motivating them never to make that mistake again.
First time I met Dr. Rogers, I said, this is a guy that really cares about people. Our student athletes, our staff, me. It's amazing, but he's probably been to my house 5, 6, 7 times just to check on how I was doing.
The one thing about him is he doesn't only do his job, he's caring. I think his job is, not just to come and treat people. I think it's to get to know them, get to know their families. I've seen countless times he's taken the time after clinic, say, hey, I've got to call so-and-so's mom or dad, talk to them about what we're doing. He's taking the extra time to meet with them after practice and do these things.
When he came to us to interview for the fellowship, we're always excited to get people that have been previously athletes, because we know they're going to have great leadership skills, and they're also going to be a great team player. And that was Dr. Rogers to a T. Great leadership skills from his prior experiences playing sports, and also a great team player. He immediately fit right into the program, and I've trained over 60 fellows now over the course of my 30-plus year career, and I can tell you that Dr. Rogers was really one of the top fellows that I've ever had, but clearly early on in his fellowship he really demonstrated an aptitude for teaching.
Well, it's always been a pleasure to work with Dr. Rogers. He's a team physician, and he's certainly a team player. From mentoring students to teaching sports medicine fellows to working with Division I athletes to working with our family medicine residents to working with our state and national societies for lectures, his research. I think he's the perfect candidate for this award because he's really the full package.